Dr. Kanell, what is borderline personality disorder?
It first was included in the DSM in the 1980s. We call it a personality disorder, but there's some thought that it's more of a syndrome at this point. It does seem to have a pretty set and stable course. But if you want to think about it in very simple terms, you want to think about borderline personality disorder as an issue with relationships, both relationships with others and then relationships with yourself. So relationships with others for people who are suffering from borderline, they tend to be pretty chaotic, and there tends to be a lot of emotional outbursts that can really damage the relationships. And then the relationship with the self tends to be pretty unstable as well. So the person doesn't have a clear sense of self. Their identity can seem to shift from context to context. And the person is on some level aware of this and is aware that there's not a really continuous through line. And so they suffer from a lot of, they'll call it dysphoria, which is kind of just feeling bad, or maybe a chronic sense of emptiness. And because of that, and then also because of the difficulties that they have with relationships, there will be a lot of suicide threats or suicide attempts. That's another very common feature of the disorder. You have these emotional outbursts, you have these unstable relationships, and then you have this sort of a sense of emptiness or a poor sense of self. And those are some of the most common things that you'll see.